Hello and welcome to the Cardiovascular Research Onlife interview series. My name is Jyoti Patel and I am delighted to welcome Professor Bezzina from the University Medical Center Amsterdam. Thank you, Professor Bezzina, for joining us today.
Thank you for having me.
So, firstly, what does the recognition of delivering the William Harvey Lecture in Basic Science mean to you?
The William Harvey Lectures in Basic Science is one of the most prestigious lectures of the European Society of Cardiology, and this is a huge honor for me, not only for me but also for my research group. And it's a recognition of our work and also of the topic on which we do our research.
And what first attracted you to the field of inherited cardiac disorders?
Yes. So I entered the field initially of inherited cardiac disorders rather by chance. I was moving from the island of Malta looking for a postdoc position abroad, and this opportunity came up on genetics of inherited cardiac diseases. I was very happy to remain in cardiovascular genetics. It was important for me to stay. But then along the years, I found a lot of opportunities in inherited rhythm disorder genetics. There was a lot of work to do. And also what I found nice to do through the years, as technologies for studying the genome developed further and further, I found it very exciting to constantly apply new technologies for the discovery of new genes underlying inherited rhythm disorders.
What would you say is your most exciting discovery today, and what were the key steps in achieving that discovery?
Yes. So I think my group is mostly known for our most recent research, which is on recognizing that some inherited cardiac disorders don't have a monogenic basis, but are genetically more complex. So I think we were among the first to test that inheritance paradigm in these disorders. And in order to do that, we had to assemble large groups of patients from throughout the world, because you need a lot of patients to achieve sufficient statistical power to test these inheritance models. So I think one crucial aspect was to make contact with clinicians in different countries and build international databases of patients with these disorders. And you need international collaboration since these disorders are so rare.
And so what do you think are the implications for patient care, but also for research, of the recognition that these disorders are genetically more complex than what was previously thought?
Yeah, starting with research, I mean, it's important to recognize that, because the tools you need to apply to the study of these disorders is then different. So we applied then genome-wide association studies as opposed to linkage analysis that we used to do before. So that's important to know, because then you can start finding the contributory genetic factors. As for patient care, it's important because you need to apply different types of genetic tests to the families, and recognizing that is important from the start.
Okay, well, thank you, Professor Bezzina, and thank you to our audience for joining us today.
Thank you.